Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. My name is Madison and I have Dr. Jenna with me.
Hello, hello.
And today we're talking about what you need to start prioritizing now because it's the end of March in order to be successful this summer. A lot of times people are like, okay, it's the summertime. Like I want to go outside, go to the water park, hang out with my kids, go on long walks, like whatever you want to do in the summer. I don't know, paddleboard. I don't know what you want to do in the summer. But being successful in the summer starts now. It doesn't start in May, June, July. So let's talk about it.
Yes, this feels like the stereotype of like get your beach body going now instead of like it's July and you're doing 800 push-ups or sit-ups.
Yeah.
It's like start now and it's like okay, that's not the thing I want you to do. That's not the like goal that I want you to have, but it's that idea of okay, you're probably getting a little bit more spring type days compared to what you were like you're going to have that itch, so start thinking about it now so you're ready for when it's consistently nice instead of going, oh, it's like kind of nice but I'm not going to worry about it until later type of thing.
Totally. And I know a lot of people are like, well, I have chronic dizziness and I'm chronically feeling symptomatic. And so, like, how am I supposed to do anything with those symptoms? And the answer is that unfortunately, you need to figure out how to do stuff with symptoms in order for your symptoms to go away. So, starting really small and working your way up, we call it in vestibular group fit starting with the basics, is where you need to begin. So the first thing you need to do, well, it doesn't have to be in any specific order, but some combination of sleeping really consistently, eating a really solid diet, reducing processed foods, making sure you're balancing your blood sugar, hydrating, probably having electrolyte every day, um, changing your mindset, and moving your body. Did I get all of them?
Yep.
I think so. Doing some combination of all of those things, likely all of them, but starting with one and working your way up is absolutely, I'm going to say, required at this point for managing a vestibular disorder. And I see a lot of people in a lot of Facebook groups asking, like, what's the one medication that helped you? What's this thing that helped you? What's the thing that finally got you over that hurdle? And it's almost never just the medication. It almost never pans out that way. Would you agree?
I was going to say, I say on the flip side too, there's maybe I've tried every medication, nothing works, or I tried this, that didn't do anything, this didn't do anything. Like these, I go to the doctor, they just want to give me a prescription and they don't work. And some of that can also be attributed to some degree of is your body ready to take that type of medication
Totally.
and use it for its intent? So, maybe a better way to phrase it is if there is a lot going on, like the basics aren't really under control, like your body might be like, why are you giving me another thing? Like, I don't know what I'm supposed to do with this when you take a medication. And then sometimes it's like, all right, I've focused on the basics. I've tried to get these like foundation pieces down. And then if you layer in a medication as an assisting point, so your body is like, oh, now I know what to do with this. Like I kind of have some bandwidth to do something with this instead of it being like, I have too much going on. Like you can't give me another thing to do.
Yeah, I think that's a really good point. There are a million and one things to do with migraine, and I think, or with any vestibular disorder, and I think that can feel really overwhelming to people. But choosing one thing to start with and implementing that into your life and then choosing the next thing to start with is not only helpful, but again, going to be one of those essential things that you absolutely cannot get away with not doing. So if you're like, I feel like the thing that I can start with is, um, I don't know, sleeping better.
Or like not
Great.
looking at my phone 30 minutes before bed. Like,
Perfect. 100%. Then if that's the thing you feel like you can do, awesome. Do that one thing. But then if you're like, sleeping for me is really difficult. I have a hard time with sleep. Okay, let's do something else that will likely end up ultimately helping your sleep, but also is going to be a thing that is also going to help you manage your vestibular disorder, like moving your body, like balancing your blood sugar, like drinking more water, whatever it is.
yeah, I think too, like a lot of like the common phrase you'd maybe hear thrown about is lowest hanging fruit.
Mm-hmm.
And the reason why that's usually the thing that's said is because that's going to be different for everyone, if not
Mm-hmm.
maybe have a little bit of overlap, but how you might accomplish that might look different too. So I know
Mm-hmm.
sometimes people want like what should I do first? It's like, well, I don't know what feels attainable to you because I might
Mm-hmm.
suggest drinking more water and maybe you're like thinking, "Oh no, I'm so nauseous. I can't drink more water right now." It's
Yeah.
like, "Okay, well, maybe we try to work on just trying to do a little bit of food and water, like a little bit more than
Mm-hmm.
you're doing. What does that look like? Like, I
Mm-hmm.
need to know a little bit more about what you're experiencing to get a better idea of what might feel like your low hanging fruit." So I know
Mm-hmm.
sometimes it's tough because they are like, is this your answer to everything? Like,
It
move,
depends.
mindset,
Yep.
hydration, sleep, like give me a little bit more specifics. It's like, well, I don't know what's specific to you. Like
Mm-hmm.
specific means it's for you. So like what is it with you? Like, I don't know.
Totally.
You gotta tell me.
Totally. Kind of like your example of nausea, because yes, you can try and take Zofran for sure. Like that's a great option. But at the exact same time, other things that you have to do in order to manage nausea, if it's caused by vestibular migraine, you need to manage the migraine itself, period. Everyone's like, what, how do I get rid of the rocking or how do I get rid of the specific symptom? You don't. You just manage the migraine itself and slowly all the symptoms come down. But when it comes to nausea specifically, it makes it so people just want to sit on the couch and not move their body, don't want to eat anything, especially not protein, stuff like that. But unfortunately, eating small amounts really frequently, drinking little bits of water throughout the day, adding something to your water so it's not just water, right? Like every American like craves Gatorade when they get the stomach flu, even though it's terrible for you.
Warm broth or something.
Warm broth
What
or
feels
so, like a
soothing.
yeah, something different with electrolytes or something along those lines where it's not just water, but rather it's something that you can drink that's still hydrating you. All of those things are going to ultimately help. And then going for a walk, which is another thing everyone with nausea hates to do, but it does actually help.
Yeah, I will try to at least again, low hanging fruit might be I
Mm-hmm.
say take the scenic route. If
Yep.
you're going to the bathroom, I say just do that. Don't like take the scenic route
Yeah.
on the way, just like get that done, but on the way back, like, okay, I'm going to like go into this room along the way just to
Mm-hmm.
like pop in and or I'm gonna like
Get
walk
some
the
extra
long way
steps.
around something to like get to where I
Mm-hmm.
was or I'm going to go to the further away bathroom if that's an option. Like what can I try to do just to encourage a little bit of more movement right
Mm-hmm.
now and that can add up over the course of the day and that's another reason why we talk about starting small because sometimes smaller bites is digestible. It's a little bit easier to start incorporating. And if you do it a little bit, a lot of times during the day or building up to a lot of times in the day, it can still be a really meaningful change that you did.
No, I totally agree with that. And I also want to talk about kind of that concept of making a relationship with your symptoms because I know in boot camp recently, we had everyone name their brain. Well, we didn't make anyone name their brain, but everyone had a name for their brain by the next call, which I thought was really fun. Um, but naming your brain or naming your symptoms is really, really important because if you put a name on it, it's easier to like interact with it and sit next to it, which is such a big piece of the mindset work, rather than saying like, oh my God, this thing is happening. It stresses me out and I hate it and it makes me anxious and I'm fearful of it and
And I
XYZ.
want it to go away. Like, why
And I
aren't you
want it
going
to go
away?
away. Yeah. The more you want something to go away, and everyone hates when we say this. I know for a fact that everyone hates when we say this because it's not a fun thing and it seems like bad advice, but it's actually the best and kindest advice we can give you is that the more you hate something, the more you want it to go away, the less likely it's going to be to go away. So people will say, if I just had this one thing not there anymore, if just the nausea was gone, if just the rocking was gone, if just the trampoline walking was gone, if just the bobbing, whatever that thing that drives you the craziest is, was gone, I'd be able to do so much. But the problem is that tells your brain that that is the most important thing for you to focus on. That tells your brain that that is unsafe, that it is scary, that it should produce anxiety. And the grass is greener where you water it, right? So the more you focus on that symptom and the more attention and fear you pay to that symptom, just the worse it's going to become.
Yeah. And I think maybe a different example of where you might already do this, but just in a different way
Mm-hmm.
is say you had like a bad day at work or
Sure.
I don't know, a bad date. I don't know, something like some sort of interaction somewhere just was not great. Maybe it was
Mm-hmm.
actually horrible, terrible. And maybe like you called a friend on your way home from it and talked about how bad it was.
Mm-hmm.
And then maybe like I don't know, your mom asked how things went because they knew you were doing something like
Mm-hmm.
important. And then you tell them how horrible and terrible it was. And then maybe you get home to your like roommate or partner or whoever it is.
Mm-hmm.
Probably not your partner if you are on a date, but whatever. Maybe. I don't care. But
Roommate. Roommate.
maybe you just get home and there's that person that is there and they ask and you're just like I cannot talk about it. I don't want to talk about it anymore
Mm-hmm.
because you're noticing that every time I talk about it, I get reworked up
Yep.
and it just makes me feel bad all over again. So sometimes, you have that moment of I don't want to talk about it because I'm sick of
Mm-hmm.
making it have me feel a certain way. And now, of course,
Totally.
that could like take you on another tangent of like you have control over how you react to things, but
Mm-hmm.
sometimes it's tough when it's still pretty new and fresh. So there's that mix of
Mm-hmm.
like, I actually feel better when I don't talk about it anymore. And
Mm-hmm.
that's kind of what's happening here, just in a little bit different way.
Totally. And I do want to say that it's important in therapeutic to be able to talk about your feelings and frustrations and things like that. But you need to set aside, kind of like in your example, a specific amount of time to think and talk about that rather than that's all I think about is this. And I know it can be all consuming and really frustrating. But another thing that I want to bring up from boot camp that someone said, well, actually, there were 10 people in boot camp, and I want to say one day 4 people said this. So that's a lot of people. And I mean, just because other people didn't say it didn't mean that it wasn't true for them. But a lot of people were basically saying, like, I notice that when I'm doing something else, I'm not so dizzy. And I think that it's important to know that dizziness and symptoms like this are distractible. So, yes, I am not saying to ignore your symptoms and suppress them and say, I'm just not going to think about it because that's not really healthy or helpful. But some combination of like, yep, sometimes I think about this. Sometimes I think about like things that I need to do for this. And then other times I watch a movie or listen to an audiobook or whatever that thing is in order to distract myself. This one particular person who comes to mind said that they do really well driving because they focus so much on driving, which I know is definitely controversial. I hear myself. But he's like, I like to go for a drive because it distracts me and I have to pay attention to the road. I know other people say they like to listen to a podcast because it's distracting for them, do like a craft because it's distracting, and they like get super focused on that thing and not so focused on their symptoms. And I think that's really important
Yeah,
to maybe
and
consider.
again, like a different example that again it's normal and accepted. So like
Mm-hmm.
why does it feel maybe like an attack when it comes to dizziness is
Mm-hmm.
you stub your toe, you whack your shin on something, you rub it
Mm-hmm.
and it
Mm-hmm.
feels better. That's distraction.
Mm-hmm.
You're
Mm-hmm.
distracting your sensory system, your nervous system to
Mm-hmm.
feel the rubbing and
Mm-hmm.
not that quick hard impact from something. So
Mm-hmm.
again, it's something that we have done. You've done it before, but all of a sudden in this different context, it's like not accepted, or it feels
Mm-hmm.
like it can come with that tone of like, oh, but is that really real then? It's like, yes, it is because your
Mm-hmm.
toe still hurts from when you stubbed it, but now it just hurts a
Totally.
little less. Like, or it feels good until you stop rubbing. So it's like, how come in this
Yeah.
situation it's fine and this one comes with all these
Mm-hmm.
other like negative connotations at times where it's like, no,
Yeah.
you can exist in this way too, and it's okay.
Yes. My favorite quote that Jenna actually got on a little sign for me that's sitting right there. If you're watching on YouTube, it's like right behind me. It says, everything in life is a circumstance and your reaction is optional. And this can be really, really a difficult one, but in the terms of things you need to do now in order to have a successful summer and like go outside and do all the things you want to do, is exactly that. So if the dizziness pops up, you need to be able to think critically about the dizziness. And this is something that we talk a lot about in vestibular group fit, um, because it is so, so, so important for you to be able to choose your reaction to a symptom. So if the floor randomly drops out from under you and you go, oh my God, that's fine. That's normal. I wouldn't expect something different. But this, you have two spiraling options now. Option one is, oh my God, okay, now I'm gonna have an attack. Everything's horrible. The floor might do that again. I'm never leaving my house again. I don't want to do this. XYZ. Okay, doom spiral is option one. The other side of the same coin is, oh my God, the floor dropped out. Okay, this has happened before. Sometimes for me, it leads to an attack. Okay, what do I do in this situation? I have a toolkit. I know what to do. I know how to prepare for an attack. If this is my prodrome, then I need to maybe go take my medication right now or use my neuromodulation device or take my supplements or whatever it is that I do in an acute situation. I have a toolkit and I'm going to be fine. And that reaction is very, very, very different than doom spiraling, sitting there and not being able to do something about it. And that's a lot of what we teach in group is how to do something about it.
Yeah, and I think what helps or what I've found helpful to kind of incorporating that is the first book club for this year, the Whole Brain Living,
Mm-hmm.
talked about it too.
Yes.
And the other one that is coming up here, that Master of Change, they both bring it up in their own words, which I think is always nice to hear like the same thing in a different way a
Mm-hmm.
lot of different times because that might be the thing
Totally.
that clicks. But they both bring up this point of like, yeah, there's that panic spiral. And part of that is when that's happening, we're not
Mm-hmm.
like that part of our brain that has the planning, the solution oriented
Mm-hmm.
type thinking. We're like cut off from that when we enter this
Totally.
like panic, dizzy, anxious cycle in this case. And
Mm-hmm.
I think learning to practice and create a space and a pause so you can access that solution part is that very initial thing that we're trying to harp on people practicing and
Mm-hmm.
doing because it's not because you're a dumb person or people go, well,
Not
I
at all.
can't think of it right now. I can't believe I didn't think about that. I know this. It's like you do,
Mm-hmm.
but if you're stuck in this like panic moment, like no one's going to know it. Like the people
Mm-hmm.
that are good under pressure, they probably took a breath and said, let me assess the
Mm-hmm.
situation. And the second
Totally.
you're assessing, you're already thinking, you're planning, that's
Uh-huh.
blocking you from going down that dizzy, anxious doom spiral type of thing.
Mm-hmm.
So sometimes that might be the first thing you're planning for in the spring is what's the one thing I can try now? What's my low-hanging fruit? I'm going to practice deep breathing, that mindset
Mm-hmm.
in times of calm, trying
Mm-hmm.
to incorporate it when there is more times of distress to really help me in times of like panic, right?
Totally.
So that might be the first thing you do. And maybe building up from there is where you start working on the basics, those movements, the taking the hydration and food when it's really
Mm-hmm.
not feeling great, but trying to do it in small doses, breathing
Mm-hmm.
mindset through it, reminding yourself this is me helping myself type of thing to start building up maybe into more challenging type movements for what you want to
Mm-hmm.
do in the summer.
Totally. I think that is a great overview of all the things. Because if you start now, today is March 25th. If you're listening to this when it comes out, that means like the world really gets warm when, like the middle of June. So it means you pretty much have 90 days to get there, which is really decent. Like if you start now, halfway through, at least halfway through, statistically, according to our research in group, within 45 days, your mindset will start to get better and it'll start to get easier to react differently in difficult situations. And then you'll be able to add other stuff, all the other things that we're talking about. And of course, these are the things we talk a lot about in group. But if you just like took what we just said and ran with it, you'd feel honestly probably a lot better. And for the people who are like, I do all those things all day, every day, it's usually some sort of combination of mindset and potentially something else inflammatory going on, which like that's not what this topic is about today, but there's usually something else inflammatory, environmental going on.
And sometimes that can be a like, oh, well, now what? Or this isn't working for me type of
Mm-hmm.
thing. And again, that may be true and that can be a thought you
Mm-hmm.
have, but then just a gentle switch of like, okay, but that gives me more information. Like, here are things that
Mm-hmm.
I can then present to this person I trust or this person that I want to get like an idea
Mm-hmm.
of where to go next. And then I can
Yeah.
share this information of here's my routine. And they may be like, great, awesome. Now we have a good starting off point because we
Mm-hmm.
know you have some solid routines and here's what you're still feeling or here's what's remaining.
Totally.
And that's going to still give us information.
Totally. And I think sometimes it's helpful to hear a specific story. So we both know a client, we'll call her Katie. Um, and she has a history of traumatic brain injury, Meniere's disease, vestibular migraine, and triple PD. Um, and she's been in like different coaching things in vestibular group fit and doing really well recently, like doing all the things, moving, has changed a bunch of her routines, taking different supplements, has a rescue medication, whatever, and has been doing really well with it. But she's like, yeah, sometimes I still get these headaches, or like sometimes I still get random dizziness. I'm just not like to the point where I want to be. But she's like, I can tolerate so much more. Like I can go outside, be with my friends, like do adventures, whatever. And the last thing for her, and I'm not going to mention the exact thing because I think people get really tied to them and that's dangerous too. But she did like one last thing, which was like inflammatory related. And now she's like, okay, like I did all of the basics. I did all of the things that we had talked about for probably like a year, year and a half. And then I had this like really solid baseline, like we're saying, to add stuff onto and then did this one last thing. And she's like, now I'm pretty much back at like 95 to 100 most days. So it is absolutely essential. It's not just that one medication. Like I would bet you $1 million that if she had just taken the thing that she's on now, it would not have worked like it is working for her now. I think it's important to know that.
Yeah, I think,
Yeah,
and yeah, that can be a lot of, again, it's different things for different people. So I think,
totally.
like you
Yeah.
said, trying to keep it like, here's a lot of good things that they were doing, and what are the things that, can be immediate, that you can immediately do yourself, that tends to be like overall a low cost, give or take. And that's what they were doing of, okay, I can get a walking routine, let me work on, like, I want to get back to the gym, but right now I'm working on things like at my home, I'm adjusting, I'm doing more like vestibular friendly type movements to try to get back there. And then they were finally getting to this point of like, what else haven't I looked at? And then I think you just listed like, there could be this, could be that, could be this thing, here's different people and resources to reach out to. And I think they were like, this one kind of speaks to me as like the point I think I want to explore first. And that's where they've been.
And it's been going great. So it is possible, no matter who you are, what your diagnoses are, for you to start feeling better and have a successful summer, but you do need to start now. You can't start in June. You can start in June for the fall.
Yeah, I was gonna say,
Yeah.
depending what weather you're trying to plan on, and
Yeah.
sometimes too, maybe if you're listening to this and you don't quite feel ready, maybe you use this as a moment to say,
Mm-hmm.
what's a time of year that I really appreciate, or this thing I like to do around this time, and what's my start date, and what's my like, okay, I have 2 months before then. What's my like warm up? What do I want to do as my warm up here? So I say you can break it down as to as many slices as you want, but trying to just backwards plan a little bit there can maybe help, maybe get you feeling like set and ready to make that start.
I love that advice. And I think a good, like, seasonal or solid just goal of things that you want to do is really, really, really important. And I appreciate that. Yeah.
Yeah, and enjoy those
Work towards something.
sunshiny days here. Use that
Yeah.
sunshine to our advantage.
Heck yeah. Please do. It's still going to be freezing here when this comes out.
But at least it'll be sunny
There
for
will be
longer.
sun, hopefully. Yes, there will be. Okay, thanks so much for listening. If you guys have questions, reach out to us on Instagram or join us in Vestibular Group Fit. Use code GROUNDED for 15% off at checkout. Bye.